Hi, I'm Corky Davis with HealthNet Connect, and I'm pleased that you could join us here today for a virtual demonstration of our product and telemedicine solutions. A number of years ago, we decided it would be important to close the gap between an increasing number of baby boomers retiring with chronic morbidities and an equal or lowering number of patient care providers. And how do we do that? So we decided we wanted to get patients more involved in their own care. And what we came up with was a solution that would allow us to do virtual house calls, virtual rounds, to be able to connect hospitals with rural clinics anywhere in the world, around the world, 24 hours a day, 7 days a week, in live streaming video and live patient EMR system. And that's what we're going to share with you today. One of our use case scenarios is to send a patient home with our complete kit of vitals devices, depending on their morbidities for CHF, COPD, or diabetes, and ask them every day to take their vitals and to send the results to us. We decided our typical patient may not have ever used a PC before, and so we wanted to make it as easy to use as perhaps an ATM machine. So if our patient is capable of navigating through an ATM machine, we're quite confident they can use our system as well. Something like this goes home with a patient, and it may sit on their desktop, and we send them home with a number of patient vitals devices. This is an ECG, for example. This is a spirometer for our COPD patients. We also send them home with blood pressure kits, glucometer and a blood pressure kit, a pulse oximeter, scale, and we also have additional devices, microscope cameras, ultrasound probes, and so forth. Primarily CHF, COPD, diabetes. We're now getting into some fetal monitoring functionality and high-risk pregnancy and other areas as well as we continue to add more devices. ENT is on the horizon for us over the next few weeks as well. So here's what we're going to do. I am going to be a typical patient, and I'll take a device, and let's say I'm diabetic. My endocrinologist wants to see how I'm doing every day. So I take this simple device. Everything is wireless. It's Bluetooth. And I simply put a strip in. That automatically turns on the device. And once the device is on, I'm going to use some test solution here instead of my own blood. But we'll just put a drop on the end. And it counts down. It does that for about 5 seconds. Once a flashing blue light pops up on the unit, it tells the patient to go ahead and touch the screen. And so you'll see where it says blood glucose, we've just touched the screen, and it tells me as a patient it's uploaded successfully my results. That's it. So I may be right here in Michigan in the United States, which is where I'm at right now, and you can be in Europe, in Paris, in the Middle East, anywhere else in the world, and we will instantly, physician, patient, be able to share each other's information and look at my vitals from home in real time. I go through this process for whatever my morbidities may be. Perhaps I'm also a cardiac patient and you're interested in my pulse oximetry reading. Same thing, very easy for a patient to use. They simply turn the power on, and in this case I would then put the probe on my finger, and we'll leave that on there for maybe about 5 seconds, and it'll start to take my pulse oximetry reading. And once it's in a very large number format, I know that it's pretty much ready to send my results. And I touch the screen, and after a few seconds, it uploads my results. Again, I can be here in Michigan. You can be my cardiologist in New York or Los Angeles right now and immediately see my results. And we're going to take a look at how you see those results next. So I've done this every day, perhaps at noon. My physician sent me home with very specific instructions. Take your vitals every day. We're going to do a virtual house call once a week with you. Or if you're still in the hospital, I want to do virtual rounds with you once a week. And we're going to talk about how you're doing at home. So now what we're doing is we're going to join a virtual patient in here. Our patient's name is Bob, and Bob is simply touching an icon on his screen, which will connect him to our virtual examination room. And there's Bob. Hi, Bob. How are you?
Hello.
So Bob is my patient. He's sitting at home. We're going to pretend like he's the one who just sent all these vitals. And Bob can be anywhere in the world. I'm his cardiologist. I can get up to 20 other specialists or people in our virtual examination room here. So I may have a cardiologist in New York and an endocrinologist in Los Angeles, and maybe his PCP is in Paris and Bob is in Michigan right now. And all of us together will join in and be on the same page as far as how Bob is trending and how well he's doing. So now I pull up my results. One of the things we find is not only absolute reductions in readmissions when we monitor a patient at home, we also find substantial improvements in patient outcomes. One of the reasons being is that we can educate our patients about their chronic conditions and talk about diet, nutrition, exercise, adjust their meds, and do all of this in a triage moment where we're checking on them daily. So if something gets out of line, it doesn't get so far out of line that Bob shows up in our ER 3-4 days after he's been sent home because we didn't make the proper adjustments along the way. So now I'm pulling up my chart for Bob, and I want to kind of walk through some results with him. And you'll see some red dots. With the light blue line, we see some red dots. And let's take a look at what that means. Whenever you see a red dot, what it means is I've set parameters as a physician for my patient at home. Bob's at home, and I said, you know what, if Bob has a systolic reading of more than 140, or a diastolic of more than 100, or maybe a glucose reading of more than 120, I want to know about it. I want to know exactly what time and day it happened and what the circumstances were. So you'll see on September 15th of 2011 at 2:55 in the afternoon, Bob's systolic was at 167. That's outside of where I want it to be. And now I can tell him, maybe we're talking the very next day in our virtual exam, and I can say, Bob, what happened? Did you take your meds that morning? I noticed yesterday morning you were off the charts. You've been doing pretty well, but yesterday it didn't look so hot. Did you chase the dog out the front door? Did you have breakfast before you took your blood pressure reading? And Bob can answer me, and we can make adjustments. And if I've got his other specialists on the line, we may make immediate adjustments in his meds as well. Perhaps his endocrinologist chimes in at this point and says, yeah, you know what, Bob, here's what I'm going to do. I'm writing a new script. I'm going to send it to you immediately. You'll get it right here through the HealthNet Connect telemedicine solution. You can print that out and go straight to your pharmacist and get a new script and have your meds ready in a couple of hours. So we're immediately taking care of Bob. Bob's not showing up back at the hospital in a couple of days where something's out of line. Now, Bob is at home, and I can share other results as well. Perhaps he's taking an ECG reading. I'll just show you how ECG looks, and we'll pull it up on the screen as well. But again, all the patient does, this is a 1-lead ECG, and I'm just powering it on. It also has a plug-in where I can put probes on for up to 4 leads. But in this case, I'm going to use it as a 1-lead ECG. I put my finger on 2 contact points here. The other 2 contact points I can put on my chest. And I simply hit the start button. And right now it's taking my ECG reading. This will go on for about 60 seconds. And again, just as we did with all the other tests, we would simply touch the screen and it sends my results. I'll show you what a cardiologist will see with that ECG reading. We'll pull that up and we can take a look at 9/26/2011. I took my ECG from home, and this is what the results were. Now my cardiologist can make some determinations as to whether or not my Coumadin might have to be adjusted, or whether or not I'm pacing well after perhaps an in-hospital procedure and discharge maybe a week or 2 ago. Again, I'm not showing up at ER in a panic with an anxiety attack or just the need for a slight adjustment of my medications, costing the hospital system a lot of money and the patient a lot of grief. Instead, I'm recuperating at home, and you're keeping an eye on me at home, and I have a virtual clinic in my household connected to my specialists around the world. We have these same results for literally every one of these vital signs you see. We can look at results for spirometry readings, and you can look at patterns and results on lung capacity, and again, scale, and certainly we talked a little bit about some of the other vitals as well. And now we can make a real informed decision and advise our patient exactly how they need to be treated. One of the things we found this works well with is taking perhaps we're looking at a patient who lives in a remote village or in a small town with nothing but a rural clinic or a field medical unit. And now I can put a unit like this into that medical unit, portable, connects just through a cellular signal, and immediately do everything we're doing right now without having to plug into the internet in a wall, And my physician might be in a university hospital in a major city within my country, and I've just closed hundreds or thousands of miles between our two facilities. And now a rural village clinic who may have never even seen a PCP, let alone a cardiologist, can be connected to the finest physicians and specialists around the world and receive outstanding care and treatment all in real time. Perhaps our patient is injured. It could be a wound. It could be a broken bone. I can bring in my orthopedic surgeon. I can take a look at x-rays. We can talk to our patient about what the wound or the injury is. I have a number of tools on the screen you'll see here that I can navigate with, and I can point out different areas. Perhaps the injury was right in here. And I'm educating my patient and saying, this is where we're going to focus, and I want to focus your physical therapy in this region here over the next couple of months. And we're also going to make sure that when you do see us the next time, your orthopedic surgeon also wants to do some testing in this region. So if you could exercise your lower back, take your meds, basically I can treat my patient while they're at home and educate them as well at the same time. Anything you see here can be shared, MRIs, CAT scans, x-rays, any kind of media files is being shared, ultrasounds with anybody else on this call. I may be doing an ultrasound with a high-risk patient, a mother who's high risk, and she's at home in bed. And we tell her, stay home, don't leave, stay in bed, don't get out of bed. But once a month, get out of bed, go down the stairs, get in your car, drive down the expressway for an hour, get to the hospital, sit in an examination room where you may risk some cross-infection or contamination, and then reverse that process and go all the way home again. What if instead we have our patient at home, safe and sound in bed, high risk, last 3 months of pregnancy, and we send them home with an ultrasound device and guide them via video, just like Bob is with us right now, in where to put the probe and take a look at how the fetus is doing, and maybe instruct them in adjustments in their nutrition or meds or anything else we need to do while we're taking their vitals and having them step on the scale and everything else we need to do to measure their BMI and anything else we want to do while they're at home. So as you can see, we have a full service virtual clinic. This also applies for virtual rounds. If you have a hospital that isn't heavily stocked on physician specialists, perhaps you don't have a neurology team, or you don't have enough cardiologists at a specific location or campus of your hospital, we can now connect the campuses where the specialists are with the campuses where they're not, and deploy our units hospital bedside. We have much larger units, 17 inches, 19 inches, that deploy bedside for a patient to be able to use, and we look at their vitals, we monitor them real time, and we conduct our virtual rounds. So I can call my PA or my nurse and say I'm ready to start my rounds, and they will go room to room and face to face, just as you see Bob and I here. I'm asking my patient, how are you feeling? And let's take a look at your test results. So now we've made the world a much smaller place, and our specialists much more impactful throughout the world, being able to connect even the most deprived areas in terms of medical care with the richest areas in terms of medical care, all in an instant. This is, in essence, what our system does. There are so many other applications. We use our system, for example, right now the neurology team at a couple of major hospital systems is using our system to do virtual exams. We have a neurologist 50 miles away from a stroke unit in one of the hospitals, and they can pull over the side of the road, take this unit out of their briefcase, connect immediately to the stroke unit, do a virtual examination of our patient, look at for constriction and dilation and motor skills and drooping and so forth, order an MRI, perhaps talk to the PCP about ordering up the proper meds and triaging the situation before I can get there in that 50-mile drive perhaps. We also have other items like a ProScope camera. This allows us to be able to zoom in very close on let's say, a wound. And in fact, I may just demonstrate this if I simply toggle over to my other camera. And this will just take me a moment, and I'll place a $8 bill out here just to give you an idea. But for wound exams, I'm switching over to this camera, and I've got a patient at home, and I ask them to please let me see how their hand is doing. Now, this is on a $1 bill, but you kind of get the impression you can see what kind of detail we get. So what does this do for your diabetic at home or for somebody going through some wound recovery? We can do measurements, and as you can see, I'm kind of on my hand here, and make some assessments as to how our patient is doing. Dermatology, endocrinology, there are a number of applications for this as well. Finally, we have a number of other products and items that make sense. One deploys bedside. It's a 360-degree high-definition camera, and it allows us to remotely control. And you can be a physician at home and check in on your patients in the hospital thousands of miles away. Zoom in, pan, tilt, get very close with a nice high-definition image of their eyes or their hands or anything else I need to do. It's great for fall management and fall monitoring in a hospital, having one nurse monitoring an entire ward of wing of patients, which creates a number of efficiencies. We have found 20 to 70% reductions in unreimbursed readmissions for hospitals, which is substantial. When we are monitoring patients at home, we've seen more than a 50% improvement in patient outcomes when we're examining our patients at home like this and doing our virtual rounds. All of this adds up to what we feel is the ultimate telemedicine solution. We are HealthNet Connect, and we're very pleased that you had an opportunity to join us today, and we look forward to you giving us a call and seeing if we can work together to improve your patient outcomes and your efficiencies as well. Thank you.